Everyone requires high-quality medical care. For increased productivity, both the ill and the healthy require a top-notch healthcare system. One of the fundamental duties of the government is to provide a good healthcare system. While most nations can improve their healthcare systems, African nations are lagging far behind. It is challenging to compare healthcare quality in Africa to those in other nations because of the differences in their economies, governments, and methods of providing healthcare. In view of the existing global health crisis, African countries with effective health systems have to be put in the focus because they may provide relief during these trying moments. In this video, we will be looking at the top 10 countries in Africa with the best healthcare and challenges most African countries face in providing healthcare for its citizens. Let's begin. 10. Zambia. Zambia has given the highest emphasis to improving its medical workforce. Premium access to the nation has been granted to medical professionals for the treatment of specific circumstances. Access to medical care in Zambia will increase as more and more medical personnel arrive on the scene. Since 1992, Zambia has been carrying out health reforms under the framework of the Sector-Wide Approach program. The swap pools resources from the government and other stakeholders, guarantee effective resource use. The goal of the health sector in Zambia is to dramatically extend life expectancy by promoting healthy environments and lifestyles. Zambia has a 38.78 healthcare index score. 9. Tanzania. During the early 90s, it was clear that it was difficult to provide universal healthcare to everyone due to escalating medical expenditures and a faltering economy. Early in the 1990s, the government implemented reforms in the health sector that replaced the free services with a combination of finance sources, including cost-sharing programs. In recent times, the government of Tanzania has given public health institution improvement top priority. To achieve universal health coverage, the nation also has the well-known National Medical Assistance Plan. The dispensaries, which are located in every village and are directly influenced by its management, are at the bottom of the list. The health centers are located at the ward level, and the ward leaders are responsible for the health center in charge. They have a healthcare index score of 40.98. 8. Rwanda. One of the most well-organized healthcare systems in Africa is found in Rwanda. Over 90% of Rwandans have healthcare insurance. In comparison to other nations, the country's budget guarantees that the health sector receives more than 20% of its revenue. The country currently operates a well-functioning, decentralized healthcare public service system comprising of 1,700 health posts, 500 health centers, 42 district hospitals, and 5 national referral hospitals. Regrettably, Rwanda's healthcare industry lacks private stakeholders. Rwanda has a healthcare index score of 44.5. 7. Morocco. After gaining independence in 1959, the nation created its first healthcare program. The state finances and manages the majority of the free healthcare services, with a focus on serving the general people. The national institutes and laboratories, basic care health network, and hospital network are all under the control of the Ministry of Health. While municipal governments oversee city health services, the Defense Department owns and operates its own hospitals. Basic healthcare services are provided for free or at a low cost to the population, and the government also provides subsidies for medication and medical procedures for those in need. There are also international hospitals and clinics in Morocco, particularly in larger cities such as Casablanca, Marrakesh, and Rabat, that provide high-quality medical care. Morocco has a 46.69 healthcare index score. 6. Egypt. The Ministry of Health in Egypt offers public health services and offers its inhabitants free medical care. The National Social Development Strategy has made reforming Egypt's healthcare system a primary goal as a developing nation with abundant human resources and a rapidly expanding economy. Egypt has a public and private healthcare system, with the public system serving the majority of the population. In order to provide high medical services, the government has constructed new hospitals, invested in new medical technology, and hired more healthcare professionals. Egypt has a healthcare index score of 47.01. 5. Nigeria. Nigeria has more skilled medical workers than the majority of other African nations. Despite this, the number of healthcare professionals per unit of population in the country is lower than what is required to adequately serve the entire nation, given its size and population. In recent years, the government of Nigeria has made significant investments in its healthcare system with the aim of improving access to quality medical care for its citizens. The government has built new hospitals, purchased new medical equipment, and trained more healthcare workers to provide medical services. Nigeria has a healthcare index score of 48.49. Are you learning anything from this video? Then like and subscribe to the New Tourist channel, and do not forget to turn on notifications so you get notified whenever we upload videos like this. Let's continue. 4. Algeria. In 1984, the country created a single-payer, universal healthcare system that enables everyone to receive medical care at no expense to themselves. All Algerian citizens have free access to the country's public healthcare system. Algeria now has 2 different government-funded medical programs in place. The Caisse nationale de la sécurité sociale des travailleurs salariés is the first and insures over 73% of the population. Salaried employees and their dependents are covered under this program. An additional medical program also provides coverage for independent contractors' dependents. Algeria has a healthcare index score of 52.88. 3. Tunisia. The Caisse nationale d'assurance maladie, a publicly funded healthcare system, provides care to the majority of Tunisia's citizens. Primary care clinics, district and regional hospitals, and university hospitals are all included. The program covers some medical care received in the private sector, practically on an equal footing with that of several European nations. Meanwhile, the public sector and rural areas are lagging behind. Additional consideration must be given to the level of care provided and the availability of affordable treatment. Malaria and cholera are no longer serious threats to the nation. Non-communicable diseases like diabetes, cardiovascular disease, and hypertension are currently the main causes of death. Over 2,000 basic healthcare facilities, 180 hospitals, and more than 100 private healthcare facilities, including clinics, are all present in Tunisia. In general, hospitals and clinics offer emergency services around the clock, giving patients access to high-quality medical care. Tunisia has a score of 56.54 on the healthcare index. 2. Kenya. In our understanding, traditional healers, herbalists, and spiritualists were the main sources of medical care in the previous Kenyan healthcare system. The World Health Organization, whose mission was to advance primary care accessibility by combining Western and complementary therapies, had an impact on the spread of contemporary Western medicine in the 1970s. Kenya has one of the highest rates of mobile internet penetration, which helps it compete fiercely with the rest of the world. This is a fantastic opportunity to use it to create a value-based system that ensures healthcare accessible. In terms of increasing access to primary healthcare services, Kenya has achieved great progress. Kenya has a score of 63.40 on the healthcare index. 1. South Africa. South Africa provides healthcare services that are comparable to those in Europe, Asia, and the United States. The largest and most developed pharmaceutical market in Africa is found in South Africa, thanks to its modern corporate environment and regulatory framework. Majority of the population is served by the publicly funded sector. The private sector, which primarily receives funding from individual contributions to medical aid systems or health insurance, provides services to over 27% of the population. South Africa's healthcare index score is 63.9. Billions of dollars are spent overseas by Africans in search of top-notch health services as a result of the low medical service on the continent. South Africa and Kenya do better in healthcare systems, but it is worth noting that while these countries are often cited as having the best healthcare in Africa, there are still significant gaps in access to care and health outcomes across the continent. Many African countries continue to struggle with limited funding, inadequate infrastructure, and shortages of healthcare professionals. We have come to the end of this video. Have you visited any of these countries and used their healthcare systems? Let us know in the comments section below. Also, like and subscribe to the New Tourist channel, and do not forget to turn on notifications so you get notified whenever we upload educational videos like this. Thanks for watching, and see you in our next video.